Hold your hand out in front of you for a moment. Palm down, fingers relaxed. Look at the shape of your nails from above, and then the curve from the side. What you're looking at right now is something physicians are quietly trained to read in under 10 seconds. And it can tell you more about what's happening inside your body than most people realize is even possible. The shape of your nail, the color of the bed beneath it, the texture of its surface. These aren't just cosmetic details. They are influenced by your circulation, your oxygen levels, your thyroid, your liver, your kidneys, and the integrity of your nervous system. Here's the part that matters. After the age of 60, these changes become more common and more clinically meaningful. But because they develop slowly, over months or years, almost no one notices. The nails you see today feel normal because you've been looking at them every day. Yet a comparison with photos from 10 years ago might reveal surprising changes. My name is Dr. Marcus Reeve. I apologize for speaking to you from this dark room. I'm on night duty and wanted to make this video for you in the free time I found. I'm going to talk about 5 specific nail findings that medical research has linked to underlying health conditions approximately in the next 20 minutes. I'll show you exactly how to check for each one in seconds, what each one may mean, and most importantly, what to do next if you spot something worth discussing with your doctor. This video provides general health insights based on current medical understanding. It's not individual medical advice and does not substitute a consultation with your doctor. Nail findings are clinical clues. They are potential indicators, not definitive diagnoses. They are meant to encourage discussion with a healthcare professional, not cause alarm. If you notice anything concerning, consulting a qualified doctor is always the recommended next step, rather than relying solely on online resources. If this is the practical, honest information you've been seeking, type yes in the comments. Your engagement helps this video reach others who might be missing their body's quiet signals. Now we can start the video. To understand why nail findings carry real diagnostic weight, you need to understand something about how nails are actually built. Your nail grows from a structure called the nail matrix, a small layer of living cells tucked just beneath the skin at the base of each nail. Those cells produce keratin, the hard protein that becomes the nail you see. However, the matrix doesn't work in isolation. It relies on a steady supply of oxygenated blood, healthy hormone signaling from your thyroid, intact nerves, and the dozens of micronutrients your body delivers daily. When any of those inputs shifts, even slightly, the matrix responds. And because nails grow slowly, roughly 3 millimeters per month for fingernails, the shape and surface that emerge today are essentially a printed record of what was happening inside your body weeks or months ago. The nail bed itself, the tissue you see through the translucent nail plate, is woven with tiny blood vessels called capillaries. The color of those vessels, the oxygen carried in them, and the proteins flowing through them all show through to the surface. When hemoglobin drops, the pink fades toward pale. When oxygen falls, blue or gray begins to creep in. When the liver struggles, certain changes appear that have been documented for decades. For someone in their 30s or 40s, the body has enormous reserves. It can mask early dysfunction for a long time without anything showing up on the nails. After 60, those reserves narrow. Not because anything is broken, but because the margin for quiet dysfunction is thinner. The nails become one of the few accessible external organs that consistently report on what the internal organs are doing. Your doctor may not be examining your nail shape during a 15-minute appointment. There's only so much ground to cover. So this information stays in medical literature, and it doesn't always reach the person who actually needs it. Let me change that today. Before we get into the 5 findings, I want to address one common myth, because it's been repeated for generations, and it gets in the way of reading the real signals. You've probably heard that those small white spots that occasionally appear on nails mean you're deficient in calcium. It's something we all heard as children. The honest answer, based on dermatology research, is that those spots are not a reliable sign of calcium deficiency. The medical term for them is leukonychia, and in most cases, they're caused by minor trauma to the nail matrix. You bumped your finger on a drawer. You pressed your cuticle back too firmly during a manicure. The matrix took a small hit, and 3 or 4 months later, the spot grew out where you can see it. This matters because if you've been believing that myth, you may have been brushing off other findings without realizing it. So let's look at what genuinely deserves your attention. Finding 1. Clubbing of the fingertips. The first finding I want you to check for is called clubbing, and in clinical medicine, this is one of the most significant nail changes there is. Clubbing is a gradual change in the shape of the fingertip and nail. The nail becomes more rounded across the top. The angle where the nail meets the cuticle becomes flatter than it should be. The fingertip itself can become slightly bulbous, almost like the end of a drumstick. There's a simple test you can do right now. It's called the Shamroth window test. Place the nails of your 2 index fingers together, nail to nail, so the cuticles touch. In a healthy nail, you should see a small diamond-shaped gap of light between the 2 nails near the cuticle. That little window of light is the Shamroth window. If you cannot see any gap at all, if your nails meet flush together without the diamond of light, that indicates a positive Shamroth test, one of the most reliable signs of clubbing. What's happening biologically is that in response to long-term low oxygen levels in the blood, the body increases blood flow to the fingertips and stimulates the growth of soft tissue beneath the nail bed. Clubbing has been linked to various chronic health conditions, including some serious lung conditions and other systemic issues. It has also been linked to certain heart conditions where blood isn't being fully oxygenated, and in some cases to inflammatory bowel disease or chronic liver disease. The reason this finding matters so much for adults over 60 is that some of these conditions remain underdiagnosed in their early stages. Clubbing can sometimes appear before any other symptom, even before a cough or shortness of breath becomes obvious. If you cannot see a clear diamond of light between your index fingers, write that down and bring it to your doctor's attention at your next visit. If you'd like more videos like this on early signs of lung and heart conditions, type the word lungs in the comments. The topics that get the most engagement are the ones I prioritize for upcoming videos. The second finding is called spooning, or in medical language, koilonychia. This is when the nail, instead of curving gently outward toward the tip, the way a healthy nail does, becomes flat or even concave, dipping inward in the middle so that it looks like a tiny spoon. There's a quick test for this one, too. Place a single drop of water on the center of your thumbnail. In a healthy nail, the water rolls right off because the surface curves outward. If the drop sits there in a small bead without rolling off, your nail is concave enough to hold liquid, which is a sign worth noting. What's happening biologically is most frequently observed in relation to deficiencies in essential minerals. When the body has been low in iron for a sustained period, the keratin cells in the nail matrix don't form properly, and the nail develops without its normal outward curve. After 60, iron deficiency can develop quietly from many sources. Slow gastrointestinal bleeding from ulcers or colon polyps, chronic kidney disease, absorption problems in the small intestine, long-term use of certain medications that reduce stomach acid and interfere with iron uptake. And here's something most people aren't told. Iron deficiency in older adults isn't just a fatigue issue. It puts additional strain on the heart, because the heart has to work harder to circulate oxygen-poor blood. If the water drop test gives you a sitting bead, mention it at your next appointment, along with any unusual fatigue, shortness of breath with mild activity, or changes in your stool color. Those details, taken together, help your doctor know where to look. The third finding is called pitting. These are small pinpoint depressions on the surface of the nail, almost as if someone tapped the surface very lightly with the tip of a needle. The pits can be shallow or deep, scattered or grouped, and they can appear on one nail or several. Hold your hand under a bright light right now and tilt your nails at different angles. Pitting can be hard to see in flat lighting, but it often becomes obvious when light catches the surface from the side. What's happening biologically is that small areas of the nail matrix are temporarily failing to produce normal keratin. As the nail grows out, those affected sections appear as tiny depressions on the surface. Pitting is most strongly associated with psoriasis, an autoimmune condition that affects the skin and sometimes the joints and nails. For adults over 60, the link I want you to remember is between nail pitting and psoriatic arthritis, because psoriatic arthritis can cause permanent joint damage and is sometimes missed in older adults who attribute joint pain to ordinary arthritis of aging. Pitting has also been associated with alopecia areata and certain other conditions affecting hair follicles or skin. If you see pitting on multiple nails along with any unexplained joint stiffness or pain, especially in your fingers, toes, or lower back, please mention both findings together to your doctor. Ask whether a referral to a rheumatologist or dermatologist might be appropriate. The fourth finding is called Bow's lines, and this one tells a story about timing as well as health. Bow's lines are deep horizontal grooves running side to side across the nail. These differ from the small, usually harmless, vertical ridges that almost everyone develops with age. Bow's lines are distinct horizontal furrows that look as if a thread had been pressed across the nail and left a permanent mark. What's happening biologically is that the nail matrix temporarily stopped producing normal nail tissue for a period of days or weeks. When it resumed, the resulting groove grew out with the nail. Because fingernails grow at roughly 3 millimeters per month, you can actually estimate when the event occurred by measuring how far the groove is from the cuticle. A line about 6 millimeters from the base suggests something happened roughly 2 months ago. The causes of Bow's lines can be significant. They can be indicators of significant bodily stressors, such as intense illnesses or metabolic shifts. After 60, the appearance of new Bow's lines without an obvious recent illness is worth investigating, simply because it can indicate that the body went through a stress event that may not have been recognized when it happened. Examine your nails under good light right now. If you see deep horizontal grooves running across multiple nails, especially at roughly the same distance from the cuticle on more than one finger, write that down. Bring it to your doctor's attention, along with any episodes of unusual fatigue, shortness of breath, chest discomfort, or feeling unwell that you may have brushed off in the past few months. If this is being useful so far, a quick like genuinely helps this video reach others who might benefit. No pressure, just appreciated. The fifth finding is the one I've been saving for last, because it's the one almost nobody has been told to look for. And it can be a quiet signal of something serious developing inside the body for years before any other symptom appears. Terry's nails are a specific appearance where the nail bed loses most of its normal pink color, becoming pale or white across the majority of the nail, with only a narrow band of pink or reddish color at the very tip near the free edge. The lunula, that small white half-moon at the base of the nail, becomes hard to distinguish because the rest of the nail has become so pale. Look at your thumbnails right now under good natural light, ideally near a window. A healthy nail bed should have a uniform pink color through most of its length, with a small white half-moon at the base. If most of your nail looks pale or whitish, and only the very tip looks pink, that is the pattern of Terry's nails. What's happening biologically is that the blood vessels beneath the nail bed have become less prominent, often because of changes in the underlying tissue and in the proteins carried by the bloodstream. Terry's nails have been observed in clinical research alongside certain health challenges such as liver conditions, heart weakness, and kidney concerns. Some studies have found Terry's nails in a meaningful percentage of older adults with one or more of these conditions, sometimes before the conditions had been formally diagnosed. The reason this deserves the final position in today's video is that Terry's nails can be present for years before the underlying condition produces any other noticeable symptom. Liver disease, in particular, is one of the most underdiagnosed conditions in older adults, partly because the liver can sustain significant damage before symptoms appear, and partly because routine checkups don't always include the specific tests needed to catch it early. Terry's nails are one of the few external signs that something inside may need a closer look. If most of your nail bed looks pale or white, and only the tip has normal pink color, that is worth mentioning to your doctor. Ask specifically about liver function tests, kidney function tests, and a hemoglobin A1C if those haven't been checked recently. These are simple blood tests that can catch silent conditions long before they would otherwise surface. Before we close, two brief observations that take only seconds and add real diagnostic value. The first is the capillary refill test. Press firmly on your thumbnail for about 2 seconds, then release. The nail should turn white briefly, then return to its normal pink color within about 2 seconds. If color returns more slowly, or if your nail bed already looks unusually pale before you press, that can be a sign of reduced peripheral circulation or anemia. It's a quick test emergency clinicians use every day, and you can do it at home in under 10 seconds. The second is a look at your lunula, the small white half-moon at the base of your nail. In healthy adults, it's usually clearly visible on the thumbs and faintly visible on the other fingers. If the lunula has completely disappeared across all your nails when it used to be visible, that's a small finding worth a complete blood count and a thyroid panel at your next visit. It's not an emergency. It's simply information your doctor may find useful. These aren't headline findings like the 5 we covered, but they're easy to check, and they often add helpful context. Knowing something and acting on it are two distinct things. I want to bridge that gap for you with a simple framework. Start today with something easy. Take both your hands to a window with good natural daylight. Look at each nail from above and from the side. Run the Shamroth window test for clubbing. Try the water drop test for spooning on at least one thumbnail. Tilt your nails under angled light to check for pitting. Look for horizontal grooves that would indicate Bow's lines. Examine the color of your nail bed for the pattern of Terry's nails. Then do one practical thing that pays off for years. Take a clear photograph of both hands in good light. Slow changes are notoriously hard to remember accurately, and having a visual record from today gives you and your doctor something concrete to compare against, if you ever wonder whether something has shifted. This week, if any of what we covered matches what you observed on your own hands, write it down. Note which finding, which finger, and roughly how long you've noticed it. Bring that note to your next doctor's appointment, rather than trying to remember it on the spot. Within the next 30 days, if you observed 2 or more of these findings together, don't wait for your annual physical. Call your doctor's office, describe what you've noticed, and ask whether you should be seen sooner. And most importantly, please don't diagnose yourself based on any single finding in isolation. What matters is the full clinical picture: your medical history, your current medications, your other symptoms, and what your doctor finds during examination. The purpose of today's video is to make you a more informed participant in that conversation, not to replace it. Tell me in the comments which of these findings you checked for, and whether any of them matched what you saw. I read every comment, and your replies genuinely help me decide which topics to cover next. As we approach the end of the video, I want to tell you this. Your body has been communicating with you every day of your life. Some signals are loud and impossible to miss. Others are so quiet, you have to know exactly where to look. What's remarkable about being over 60 is the wealth of context, lived experience, and access to medical support you possess. The decades after 60 aren't when meaningful health changes become impossible. Rather, they're often when small, informed observations make the biggest difference. The nails you looked at this morning, and probably never thought twice about, may be one of the most accessible diagnostic windows your body has ever given you. You just needed to know what to look for. And now you do. And the last reminder for his video. Everything we discussed today is general educational information, not personalized medical advice. Your specific situation, your medications, and your full medical picture can only be evaluated properly by your own doctor. If something in this video raised a concern, please bring that concern to a qualified physician. If today's video was useful to you, please consider subscribing. It's the best way to make sure you don't miss what's coming next. And if someone you care about could benefit from knowing these 5 findings, a spouse, a sibling, a friend, please share this video with them. The next person you forward it to might be the one who notices something on their own hands tonight. Take good care of yourself, and see you in the next video.